Hello. The topic of this sales presentation is opioid crisis. Many people deal with chronic pain. Often the chronic pain is a result of an accident that occurred on the job. Through an employee assistance program, employers can help their employees get the help they need in order to resolve addictions as a result of chronic pain and dependency on prescription medications. The references selected explain the addiction and the alternative methods for treating the patient. This sales presentation will discuss 3 different marketing approaches and how each impacts the presentation. Approaches that will be discussed are the stimulus response approach, the selling formula, and the needs satisfaction method. Let us begin. Within the opioid crisis, one of the root problems is chronic pain. There are 3 different selling approaches to present solutions of opioid addiction to a corporation's employee assistance program manager. In order to present solutions, we must understand the root problem, chronic pain. Chronic pain can be caused by neurological damage, acute inflammatory arthritis, burns, cancer-related pain, and phantom pain, to name a few. Over the past 20 years, there's been an increased rate of reliance on pharmaceutical opioids to help treat pain. It is this dependency that has created the opioid crisis and the reliance on prescription drugs. EAP programs offered by the company can help employees choose alternatives to dealing with chronic pain. Yu, Long, and Wu discuss in their article that acupuncture is a non-pharmacological treatment. The opioid receptors in the spinal cord are most affected by this treatment approach. It is suggested that acupuncture detoxification specialists administer this treatment for the best results. Stimulus response sales approach. Just as the name indicates, when you present a stimulus that is associated with a specific response, the target will respond exactly how they were trained to respond. In selling, this is associated with the stimulus response. The advantage of this method is the company's specific message is communicated to the targeted audience. It doesn't matter who is presenting, the message is the same. A stimulus response message is presented by using a canned script. An example of this would be, Mr. EAP, would you agree that there's an increase of workers missing work due to work-related injuries? Prospect, yes. Mr. EAP, you would like your employees to become healthy, correct? Prospect, yes. Mr. EAP, often the worker compensation physician likes to prescribe opioids to patients with injuries, especially those experiencing chronic pain. Wouldn't you like your organization to offer alternatives for your workers? Prospect, yes. Using this format, the presenter controls all aspects of the conversation, and the message is conveyed the same with each presentation or presenter. The presenter is facing questions so that the prospect will answer the question in a manner that leaves no room for interpretation or interaction. Selling formula. This selling approach consists of 4 steps: awareness, interest, desire, and action. In this approach, the prospect is involved in the buying process. The interaction requires engaging the customer in conversation to address their needs. This process of selling requires a skilled salesperson to actively listen to the customer needs. An example of this sounds like, Mr. EAP, I know you would like to help your workers get healthier faster. Did you have any ideas on how you would like to help them? Prospect, yes. We would like to offer them alternatives to opioid treatment, such as acupuncture treatments. Mr. EAP, do you have any programs in mind? Prospect, no, this is not an area we have experience with, but would like to learn what is available. Mr. EAP, there are 3 acupuncture facilities within a short distance of your main office. Would you like to visit their offices and see for yourself? Prospect, yes. When can we visit their facilities? Presenter, I can coordinate the site visit for the next week as part of our services you are interested in purchasing. In this process, the seller can move around the 4 elements of awareness, interest, desire, and action that best suits the interaction between the EAP manager and the presenter. Each presentation will be slightly different, yet cover all key elements in the selling process. The last presentation is the need satisfaction. The need satisfaction method of selling is also referred to as a customer-oriented selling approach. As its name indicates, this method identifies the customer's problem or need as they see it. Then by examining actual data, the presenter can customize the response to address the need. There are 3 stages: the needs development, needs awareness, needs fulfillment. The main goal is to identify what is the problem the customer is trying to resolve. Then, the salesperson presents options to the prospect to resolve the problem. The presentation might sound like this. Mr. EAP, what is the most common reason employees come to EAP? Prospect, many are mandated because they are presented positive in a random drug screen. This is increasing with employees that are experiencing chronic pain due to on-the-job injuries. Presenter, Mr. EAP, are you seeing this in one area of the company more than another? Yes, the loading docks. Mr. EAP, after further research, this is happening across all departments. We can help you with this issue. We can offer various training programs that help prevent injuries from occurring and connect your employees to local gyms to help focus on wellness programs. In addition, we can also offer treatment alternatives to traditional treatment options by suggesting acupuncture as the first step in treatment of soft tissue injuries. The need satisfaction approach truly engages the prospect and the dialogue and buy-in of the proposed solution. In conclusion, each of the 3 selling approaches presented accomplish the same goal: to sell a service or product that fulfills a need. From telling a customer what they need to helping a customer understand the root problem and offering options, each arrives there differently. In the end, a good product bought by an informed purchaser results in a need filled. Thank you.